afternoon, everyone. We're going to continue on the gut because I figured it would take a couple of Facebook Lives to really get into this a little bit more deeply. And so today we're going to talk about you are what you absorb, because a lot of people say you are what you eat and eat healthy, but if you're not absorbing the nutrients, then you're not getting all the benefits. So we're going to talk today about you are what you absorb, and we're going to focus on the small intestines, which a lot of times people aren't talking too much about it. So we're going to get some information out there about the small intestines specifically. So the small intestines are where your food mixes with digestive juices, and that's where your nutrients enter the bloodstream. So that's where a lot of the nutrient absorption is actually happening, is in the small intestines. There's a condition called small intestinal bacterial overgrowth. And what happens in small intestinal bacterial overgrowth, or SIBO, as you can see our acrostic, because that's really what it's known for. Most people call it just SIBO because it's easier to say. Is what happens in this case is bacteria that should be in your large intestines ends up migrating up into the small intestines. That's the main cause, but you can also have bacteria that's native to the small intestines overgrow as well. The small intestines, it does have some bacteria, but it does not have nearly as much as the colon, and it's also different species that are growing in each place. So then you're having the wrong species in the wrong place, or also an overgrowth of bacteria that really shouldn't be that much there. So basically what happens in this case is the bacteria feed off undigested food in your small intestines. And really one of the main causes, which we'll get down to here, is that your migrating motor complex that is pushing the bowel wave, that's pushing all the food, the bacteria, the toxins, all the way through your digestive system and out the stool. If that gets damaged or starts moving slow, everything's moving through slower. Bacteria, food particles, especially carbs. Carbs are what ferment and produce gases. And there are certain carbs that are more fermentable than others, but for the most part, the carbs and the sugar, all the good things in life, are what the bacteria feed off. So in this case, that migrating motor complex is pushing things through slower. Bacteria is just feeding on this undigested food, and basically it produces gases in the small intestines. So hydrogen gas, and I put diarrhea in parentheses because most people that have hydrogen dominant SIBO are having diarrhea. You can have mixed, where it's diarrhea and or constipation, but normally diarrhea. And then methane gas. Methane actually is very unique. It's not a bacteria in itself. It's a single-celled organism that feeds off of hydrogen. So you have to have the hydrogen, and then the methane is produced, and people that are methane producers are generally very constipated, meaning they may go a very long time without having a bowel movement, and they're full and just not feeling well. So what are some symptoms and signs you may have SIBO? Gas is a huge one. Bloating. I'll have people tell me, I have not eaten anything. I wake up in the morning, my stomach's flat. By the night, I feel 9 months pregnant. So a lot of times what's happening is they just bloat and bloat and bloat because that food is moving through there so slow. And they say they get really full after barely eating anything. That's a big sign and symptom. You don't have to have that, but bloating is pretty common. And again, diarrhea, like I said, or constipation, abdominal pain, even skin issues. We talked about last week when we talked about the large intestines, the connection with the gut and the immune system and the gut and skin. Rosacea, you can get, another one I didn't put, you can get brain fog and fatigue because you're also getting nutritional deficiencies there, which I've got vitamin deficiencies, specifically A, B12, D, and E are the most common ones that you see there, or the fat-soluble vitamins. And I really think this is an important point. A lot of people are diagnosed with IBS. 80% of people with IBS also have SIBO. And a lot, it's really been said a lot, SIBO could be definitely the root cause in a lot of IBS patients. So to get rid of IBS, really addressing SIBO and testing for SIBO is really important. So what are some causes? I already mentioned it was a problem with the wave pushing through too slow. So people who have damaged nerves and their motility is slower, like diabetes is a very, very common condition. You'll get some gastroparesis there, slowing of that. And scleroderma also, because you'll get thickening of there and everything's not moving through like it should. Physical obstruction, so adhesions, previous surgeries, people that have had to have multiple abdominal surgeries, the adhesions prevent that migrating motor complex from doing what it should as well. Meds, antibiotics, acid blocking meds, and a lot of people, anytime they have stomach problems, are put on acid blocking medications without trying to figure out why. And acid blocking medications then lower that pH, and they can make the situation, or raise it too much, and they can make that raise the pH too much and can make that situation worse, especially if you've been on it for years. Diets high in carbs and refined sugars. Again, we're going back to the good things in life. So when we're getting rid of SIBO, we'll talk about treatment. Those are going to be diets. We need to do a diet that's low in fermentable carbohydrates to start out that bacteria. So diets high in carbs and refined sugar. And there's lots of other causes. Stress, which stress causes everything. We've already talked about that. How do we test for this? The gold standard is actually the breath test because we're trying to measure the gases. And you may say, hey, I went to my GI doctor and had a breath test. But that breath test may not have differentiated between hydrogen and methane. I cannot emphasize enough, you want a breath test that is testing for both hydrogen and methane, because if not, you can get false negatives. Even if you get a positive, you want to know which one you're treating because it's going to be a different treatment. And while, symptoms can help, not always, are the symptoms lining up with what you'll see on that. So that is the gold standard. And we do breath testing, at our office. I've done it for a long time. Aerodiagnostics is one of the great company that we use for that. The stool test can be an indicator. You guys know I love my stool test. You're not getting away from pooping in the cup, okay? So the stool test can show us if there's elevated levels of good bacteria. That can be a sign of SIBO. And you can, some people are like, oh, you can't get too much good bacteria. Yes, you can. You can have too much of a good thing. And that can be a sign that you need to look at the breath test. And now, actually, some stool tests now with our GI map is testing for, what we talked about with the methane as well. So treatment, okay, diet, starve the bacteria. So there's different diets you can do. The low FODMAP is one. That's a low fermentable diet. So what we're doing is we're removing the carbs that ferment and cause that overgrowth and the gas and bloating and uncomfortable things. It doesn't mean you have no sugar at all, but it's removing the fermentable carbs. Then the specific carbohydrate diet, which is much more strict with some of the sugar rules, but we'll use different ones depending on the person. There's also a SIBO specific diet that combines these two. But I definitely recommend working with a practitioner on that because the diet is important. Diet alone, though, is normally not enough. I mean, if you did the diet for a year or two on its own, it's definitely going to help you some, but you really need a lot of extra help. The other treatments, and I say antibiotics, and I know antibiotics are up here in the cause, but the antibiotics we use, Xifaxan and or neomycin if it's methane positive. Xifaxan stays in the small intestine, so it's not going to get rid of all your good bugs. So it's an antibiotic that, if needs to be used, is great. It really helps with symptom relief a lot. But I will say this, I've had plenty of people come in and say, hey, I had 3 rounds of Xifaxan, I'll feel better for 3 weeks, and then I'm back again. And that's because you can't just give an antibiotic and say, see you later. You have to figure out the root cause. Why is the migrating motor complex moving slower? Why do I have SIBO to begin with? Because if you don't address that, it will come back. So I think that's super, super important. Plus, Xifaxan can be expensive, and nobody really wants to continue to take it as an expensive medication. Herbals. Herbals work really great. There's broad spectrum herbal medications that we use. Metagenics is a great company that has a Metagenics AR and BR broad spectrum herbals that work really well. And we want to combine a bunch of these. And they do really good. I mean, studies head to head against antibiotics. A lot of times they can do just as good, if not better. And the prevention rates with SIBO coming back are lower a lot of times with those. But that's going to be dependent on the individual and how severe it is. Sometimes we'll do antibiotics and then move into herbals. It also depends on cost, right? Is your insurance covering these antibiotics? Because if not, the herbals will be more affordable. But it's definitely, I cannot emphasize enough that it's going to be individualized for SIBO. And again, look into root cause. Circle that. You've got to get the motility going. So a lot of times we use agents as well, like ginger, different things. There can be even prescription medications we use because we want to get that motility going because that's the problem, right? I mean, we can give you medication so the cows come home, but why is the motility not coming? Maybe you have adhesions from surgery and you need to go to a physical therapist to help work on those. So we need to figure out what the root cause is and get the motility going. And then I have replaced vitamins lost. So, a lot of times people have nutritional deficiencies with this, and they're not absorbing the oral vitamins well until SIBO's gone. So, we might use sublingual under the tongue. We might do intramuscular. At our office, we do B12, and we do a multi-intramuscular, and that really helps a lot to get the nutrients into the bloodstream and bypassing that gut malabsorption, because you're going to not feel good when you've got these, and really it takes a while to get the gut healthy again. So a lot of times we want to replace, the vitamins lost as well. So that's really important with SIBO as well. So anyway, I really enjoyed talking about SIBO and gut health, and I just want to thank you all for watching. And again, follow us on Facebook at Emily Kopek Restorative Functional Medicine, where you're watching right now. Follow us on Instagram at Restorative Functional Medicine. Give us a call, 865-367-9506, or email us at support@restorative-functional-medicine.com. And we do have a special going in November, New Patient November, 10% off new patient visits. And for our established patients, anytime you refer someone and they schedule, you'll get $10 off your next visit. So we're excited for November, and we also have an open house coming up in December, so we're going to talk about that soon. Hope everyone has a great afternoon, and I'll see you next week.